Good evening. There is absolute mayhem out there. Outside every emergency department in the city, people are crying for admission, crying for beds, crying for oxygen. People are running helter skelter for oxygen cylinders. Don't know what to do. We all feel helpless. But then, knowledge is power. And in this session, I'm trying to guide you, to empower you, so that you can make decisions yourself and not be dependent on anybody else. And then seek help for medical aid. Seeking help, ignorant about the whole thing, is not a very wise thing in these times. That's because no one understands the disease well. Do I understand the disease well? I'm still learning. I'm studying. I'm talking to patients, listening to them, understanding their level of problems, and then rationalizing what I'm observing. And in the last 1.5 years, when I started observing the disease, evolution, and the processes that we have initiated in controlling it, we have become wiser, but not sufficiently enough to get control of the virus. At the moment, the virus is in control. We have to get the virus under our control. That's possible with herd immunity and with vaccination. The trouble with herd immunity, large number of people get infected, and if you don't know how to deal with the infection, you will have a large mortality and morbidity, which nobody likes. So my attempt is to see, can we understand the disease properly? The virus, it enters our body from the air passages, from the nostrils, from the mouth. We breathe in the virus, it settles on the throat, enters the cell, and then starts multiplying. Within days, 1 or 2 days, there are millions of viruses in our body circulating. And we are also shedding the viruses. So we are infective. So in about 4 days or so, we are infective. And anybody who comes close to me and share the same airspace close to each other without a mask will get infected. The last wave, it was not so contagious. This one is really contagious. Last wave, we had 1 or 2 people affected in a family. Here, everybody in the family, including the housemate, is affected. So that's a little scary. The contagiousness is very high. But having said that, once it is multiplied and come into millions, is the body silent? No. Body has recognized there is an invasion going on. There is a foreigner in the blood and in the cells. We have to fight it. And it produces antibodies. These antibodies start fighting. By the 5th day, the fight has reached a level where it produces symptoms of the fight, which is fever. Inflammation is part of a fight between the antibodies and the viruses. Fair enough. Produces cough, where the fight is there in the throat cells, inflammation in the throat, sore throat, little stuffy nose, no running nose like you have in a common cold. No, it's not a running nose. It's a little stuffy nose. You have fever, body aches. You don't want to do anything. You want to lie down and doze off. It just tires you. Those are minor symptoms. And 80 to 90% of people, these are the only things that happen after the virus infects them. Nothing else happens to them. They are clear. Then what is the issue? In about 10 to 15% of patients, for unknown reasons, as said, we do not know. It could be genetic, it could be environmental and genetic, it could be many other things. We're still learning about it. The virus has provoked the antibody to be produced. The antibodies recognize the virus as foreign material. How does it do that? There's a small spike protein. The pictures that you see of the virus, the little spikes that are out there with the little nice pink, it looks beautiful, like a crown, but actually is dangerous. That is the spike which is used by the virus to enter the cell. There are certain cells in the body which are very similar to these spikes. They have a surface thing which is very similar to these spikes. And those are ACE receptors in the lungs, kidneys, and intestines. To a small extent in liver also. These antibodies, by third day of the first symptom, have by and large eliminated the virus. But when you test at this stage, it will still be positive, RT-PCR positive. Why is that so? Because the RT-PCR is checking for not the living virus, it's checking for the virus's RNA material. Therefore, those RNA materials are being shed over several days. Therefore, you will test positive for several days or even weeks. Don't go by that. They have not been able to culture living viruses from human beings after 9 days. That's fairly reassuring. So the virus is finished. Your body immunity has finished. You don't need medicine to finish the virus. Then what is the catch? The catch is the antibodies that were produced to attack the virus and the chemical interaction that happened provoke something known as a prothrombotic phenomenon with a massive load of antibody related cytokines or special chemicals to fight the virus being released. Well, so far so good. If there are no viruses, there'll be no fight and you're clean. Not so. There are some cells in the body, the alveoli of the lung, as I mentioned, where these spikes are there, so these antibodies go and attack. Once they are attacked, there is damage. Once there is damage, there is roughness there. And once there is roughness, the blood clots within that. This blood clot prevents the flow of blood in your lungs and oxygenation of blood. Well, that's a serious issue. Depending on how much of lung is damaged with this blockage, the oxygenation keeps dropping more and more. But evolutionary, our lungs are brilliantly designed. We have two of them. And in the normal day-to-day activities, when we are sitting on the table like I am sitting like this and talking to you, I use probably 1/3 or maybe 35% of my lungs. Rest is there, reserve. Why do I need to have the reserve? Remember, we were in the hunter-gatherer period, competing with wild animals, running and chasing and flight and fright. But normal day-to-day activities, so survival dependent on that specific activity and ability. So the extra capacity in the lung was for that. When you check for the saturation in that running period, or when you climb 5 stairs, when I climb 5 stairs of my hospital, I get a little breathless. If I put the pulse ox there, it will still be 100% or 99%. It doesn't mean that my saturation will drop after the activity that I have done. So what happens? In lung surgery, cancer patients, you remove one lung. Does their saturation become 93%? No, it's still 100%. Therefore, this is the biggest mistake people in Europe, US, and even in India are doing. They put on a pulse oximeter, which is digital sensor to check oxygen levels in your blood. You can make that with a sensor using the blood color. So you know oxygenation is good or not good. When the oxygenation is good, it says 100%. When it is poor, it keeps going down and down. And once the level reaches below 93, or some people say 90%, you're entering a critical phase of your illness, which means normally the reserve capacity is gone. Two-thirds is the reserve capacity. And if two-thirds of the lung is damaged, only then does your saturation drop. You're too late. So people sit at home with their sensory digital oxygen measuring devices and go to the hospitals at the last minute, 9 days down the line. And at that time, the lungs are severely damaged. They definitely need oxygenation. They definitely need a special machine to help them breathe. Therein lies the thing. So you, by policy, ask people to sit at home with this till it is 93 and then only come to us, which means when they come to you, your lungs are already gone. Your job as a physician to prevent this from happening. To prevent this, you have to recognize it early on. So to give an example of thundering clouds coming up in the sky. Oh, it's going to rain. So I'll take an umbrella. Do I open it? No, I keep it in my bag. Then what do? It starts drizzling, showers. You put a umbrella. But soon it turns into a bad storm. What do? Close the umbrella, go to a shelter. Because the umbrella will break and it will be blown away. That is what we are allowing to happen. Allowing the umbrella to be blown away. Your steroid is the umbrella to protect you. Giving it when the storm is raging on the 8th, 9th day, it doesn't become very effective. It is effective to some extent to mitigate the problem, but it is not sufficient enough to provide you safety. This is the key mistake that everyone is doing. Don't sit at home with a digital oxygen sensor to check your oxygen level in your blood. Don't do that. That's a mistake. So then when do I open the umbrella of steroids? I open it when on the 5th day patient has high grade fever, not just 99, many have 99, maybe 101, maybe 102, or has a deep throaty cough. He keeps coughing but nothing comes out. Or he'll say, you know, I'm really choking sensation, a little breathless sensation. That is an indication that there is a shower of cytokines flowing out and you have to be alert now. Then he gives steroids. Is that sufficient? No. The shower is there. If you don't use the umbrella, you will get wet. So what do? You will use the umbrella of steroids. In addition, those areas that are likely to be wet, you need to cover it, prevent it from getting wet. And what is that? You put an anticoagulant, which then protects you from coagulation in the lungs. A lot of people say, no, you're not doing anticoagulant. No, aspirin is good enough. It's an antiplatelet, blood thinner, it works good. It doesn't. It is not sufficient to prevent coagulation in this disease. It can be shown very clearly by test reports of the blood counts of these patients that their platelet count is lower than the normal people because of the virus infection, which is quite a common thing. This platelet reduction doesn't protect against coagulation. The protection against coagulation is only by anticoagulants or blood thinners. So the key umbrellas that you want on the 5th day, fever, cough, and breathlessness is that steroid umbrella. Again, steroids are dangerous, but you're giving it only for a short period of 6-7 days. You don't even need to taper it. You can just finish. No. So that's 10 days. But you continue the 3-week anticoagulants because there is a tendency for clot formation even after the virus seems to have been eliminated. So that is the key point in understanding that this patient is having a cytokine shower. Protect him using the steroids and anticoagulants. You do not need to take the medicines that are touted. What are they? Azithromycin, doxycycline. These are antibiotics useless against the virus. The antibiotics can be considered not in the 5-day period. No. When the patient is settling with the steroids and on the 6th, 7th day of the steroid, he or she develops a situation where the patient has a different, and that is an infection secondary to bacteria. You've given steroids, the steroids suppress your immunity, and once the immunity is suppressed, the bacteria that are colonizing in your lungs now get an opportunity. Because you are weak in immunity, it comes and has the upper hand, provides a pneumonia. What the virus has provoked, not the virus pneumonia, virus has provoked an inflammatory pneumonia like picture. It is not a true pneumonia. But after these immune suppression by the antibodies, you gain it for 3-4 days, the bacterial pneumonia now takes over. And that is when the patient becomes serious. And that is when the comorbidities of diabetes and other things come into a significant influence in influencing mortality. This you have to remember. And you have to recognize this by doing appropriate tests at that time. You do the blood count, look at the white blood counts. In the early phase of the disease, white blood count is lower. In the late phase of the disease, the white blood count can be higher if there is a secondary infection. The inflammatory markers all become higher to some extent. But if it is haywire, you know that your umbrella was useless, it has got blown away. And the patient can become serious. So this is recognition of when to start antibiotics, not in the early phase. When to start steroids, not in the first 5 days of the illness, after 5 days. Antibiotics after 8 days of the first symptom, if there is fever and breathlessness. That is why you look for a true pneumonia. And you need to do CT scans, not in the early phase, invariably it will show normal. You get radiation anywhere depending on the size and body width of the patient, anywhere from 400 to 800 X-ray exposure of radiation. Don't take it, especially in women, risk of breast cancer. You don't want to do that. We have been saying this. So you do one CT scan, or maybe much later on another one if necessary, if the patient is symptomatic, has other problems, fibrosis and other things. Otherwise, one CT scan, if necessary, if he's improving, no problem. If he's stopped improving or there are complications coming on, then you do it, not otherwise. So, what about the medicines that everyone is giving? It doesn't work. Like ivermectin, it's an anti-parasitic drug. Insufficient evidence that it works. Remdesivir and tocilizumab, again insufficient evidence that it works. The CDC Atlanta recommends that there is insufficient evidence in support of these drugs, and therefore you have to use them judiciously. What about plasma therapy? Does it work? Research done by ICMR itself has shown that plasma therapy does not reduce anything. They say that plasma therapy doesn't work. Published work in British Medical Journal with a multicentric study done in India. So if I were told go and get plasma, in today's time, first of all, getting plasma is difficult because of the epidemic was almost coming down. So very few people are eligible. And on top of that, about 30-40 days gap is required from infection healing and the antibody giving. There are very few people for that also. Then all the risks and problems of transfusion related reactions and complications. All those things can be avoided if you want to avoid plasma therapy. Remdesivir, it costs the earth. Insufficient evidence, therefore I wouldn't spend my money. When the doctor asks me precisely, I said, we can't find it. If you can get it, you may do it, but it shouldn't be very expensive. It is very expensive. Sold in black. I have patients whom I know got it for 1.25 lakhs for 1 amp. They'll pay anything for their life. This is the time when people realize life has value. I think we need to recognize the value of life even without these pandemics. So the key messages I have to give is: 1. Identify the first symptom and prepare a timeline of your infection, how it progresses. If you're symptom free after 5 days, be happy, celebrate. But precautions of masking and sanitization should continue, because you can still get a second infection. I know about 3-4 people who've got second infection. Vaccine protects not in the acute epidemic phase, but later on it is useful. It will protect, but I know people who got infected going for the vaccination, standing in the queue and getting exposed to healthcare workers that are positive. So be careful, be very, very careful about sanitizing and your mask when you go. Then, first 5 days, what do? Nothing. You have body ache, you have problems of little sore throat, you may do gargles. For body ache, you may take paracetamol, and you want to build your general immunity, especially those from the compromised intake communities where poverty has prevented them from having a good nutritious food. It's good to give them vitamin B, C, and D. That will take care of their immunity in a natural way. So that is what we do. But watch, by the 5th day, if symptoms reappear, you know that is a cytokine shower beginning. Deal with that by giving steroids and anticoagulants. Beware of steroids in the early phase, because viremia, the virus will keep multiplying otherwise. Antibodies will not be able to kill them because they are suppressed by the steroid. Anticoagulants, use them with caution again. Why? People with bleeding tendencies, with piles and other problems, they'll have excessive bleeding. Peptic ulcer, they may have excessive bleeding. So we don't want to get into these problematic areas. Therefore, seek these medicines only in consultation with a doctor. That's the message. And if they continue to have fever after the episode of first cytokine storm period is over, and they continue to have fever after 4-5 days, it is most likely secondary infection, and they will sick. Using digital sensors for oxygen saturation assessment is waiting for the lungs to be damaged fully and then making sure that the patient is likely to go to an ICU. So please don't allow that. Knowledge used intelligently can save the world. Thank you very much. Wish you all the best.